Hi everyone, my name is Tracy Donegan. I'm the founder of Gentle Birth. Welcome to our latest episode of Gentle Birth TV. Now in today's episode we're going to talk about restless leg syndrome, or also known as RLS. So as you may already be experiencing, getting a good night's sleep in pregnancy can be a challenge. And then you throw restless legs into the mix and it can make getting a good night's sleep almost impossible. I remember for me, it felt like ants under my skin and I just had to keep moving my legs. Really uncomfortable. So research suggests that around 25 to 26% of women will experience it during pregnancy. And most women definitely disappears after pregnancy. But one small study did suggest that around 60% of the women who experience restless legs during pregnancy reported the symptoms again in a future pregnancy. So you may already be trying some of the recommendations that I'm going to suggest, but if you're not, some of them are definitely worth a try. So first of all, talk to your care provider about your iron levels and magnesium levels. Most women in the Western world have less than optimal magnesium levels, so a supplement might be helpful for you. Reduce or eliminate stimulants such as caffeine, alcohol, and cigarettes. Some people swear by magnesium sprays, lotions, or gels, but most of the research shows that only a minute amount actually gets through the skin, which in normal circumstances is a really good thing because we want the skin to be a protective barrier. Lots of women find the body scan meditation in the Gentle Birth app can be quite helpful too, as you redirect your focused attention to different parts of the body. Try a spiky ball under the foot or under your calf. Better still, get out of bed, stretch those muscles because that will disrupt the signals to the brain. Exercise. Even some gentle yoga stretches can help. Some small studies suggest that yoga can reduce the severity and the stress associated with restless legs. Try a warm bath with Epsom salts before bed. Massage your legs before bedtime, or better still, if you have a willing partner, ask for their help, especially in late pregnancy. Try applying a cold washcloth or an ice pack. You may see discussions online that women talking about using tonic water, and that's because in some countries tonic water contains quinine. But do talk to your care provider, as quinine is not recommended in pregnancy. Now you would have to take large doses of quinine to have an effect, but some women do report feeling better almost immediately with only a small glass. But be sure to talk to your care provider first. So now let's talk about some of the emerging and quite interesting treatments that other women have tried. As I've been researching this topic, I came across some new research about TRP, that's transient receptor potential. So these are channels and they're found throughout the body and they respond to sensations such as taste, heat, cold and pain. And they can be activated by a variety of flavors and scents. So these flavors and they stimulate the TRP channels, and quinine is quite bitter, so maybe that's how the tonic water works. So essentially they tell the nerves to calm down. There are TRP channels in the mouth, throat and stomach, and when they're stimulated they immediately impact nerves in the spinal cord. This is because it's a neural pathway, so the effect is really fast compared to medication that has to be processed by the body, or creams that have to be absorbed into the bloodstream. So during my research, what I found was that some people find that a couple of sips of tonic water or a spoonful of mustard, yes, or pickle juice helps in less than 5 minutes. And this might also be helpful if you get those leg cramps at night as well. Strong flavors like vinegar, ginger, pickle juice, hot peppers, mustard, and quinine all stimulate those TRP channels to override those nerves from firing off at 2 a.m. when you've just nodded off after multiple bathroom trips. One of the strangest recommendations you'll probably hear as a cure for restless legs is to put a bar of soap at the end of your bed. So what would be the mechanism for relief of restless legs by having a bar of soap under your bed? Is it placebo or something more? Some scientists believe that it's the scent that triggers the TRP channels. And there's already lots of evidence that scent can reduce pain. So it is plausible and there's no side effects. Restless legs can cause significant sleep issues in pregnancy and stress. So do talk to your care provider about trying some of these options. Keep in mind what works for one person may not work for another, and you may need to try several different approaches. Keep trying until you find what works for you. Maybe keep a couple of packets of mustard by the bedside and a bar of soap under your sheets. Unless, of course, the mustard gives you heartburn. So we'll cover that in the next video. Thanks for watching.